Hi everyone, and welcome to my presentation on correlation analysis of health and mould in buildings based on the Health Survey for England. Mould is a major health problem in UK, affecting both living conditions and residents' health. My study explores the correlation between mould and various factors, including health, building conditions, and socio-economic states, using the data from the 2010 Health Survey for England. Mould could cause many health risks, contributing to respiratory issues and mental stress. To investigate this, I look at the data from 2010 Health Survey for England. This survey is a national annual survey that has been conducted since 1991, managed by the National Centre for Social Research and the Department of Epidemiology and Public Health at UCL. The survey provides useful data on the health and lifestyles of adults and children across England. This data allow us to assess the impact of environmental and socio-economic factors on the public health. For this study, I focus on identifying variables from these datasets that are linked to mould growth. From existing literature, I selected 23 potential features that could influence or correlated with mould, this including building conditions, socio-economic factors, and residents' behaviors. The main method of analysis including chi-square tests and logistic regression. Chi-square tests is used to test relationships between categorical variables such as heating method and mold presence. The logistic regression applied to assess how different variables such as overcrowding and income collectively impact of likelihood of mold growth. These are two examples of the main methods. Through the analysis, I found 30 variables that significantly correlated with building mould. This including number of bedrooms, household type, number of residents, education level, income level, tenure, region, urbanization, regional deprivation, pet ownership, respiratory states, asthma, and sleeping difficulties. Table 2 is the classification of the coefficient estimates for those variables, excluding regions, where a positive coefficient indicates that the probability of mold presence increase when the value of variables increase, and on the other hand, a negative coefficient means that the probability of mold presence decrease when the value of the variable increase. The higher the value, the higher the probability. As an example, the coefficient estimates for income is a negative value. This means that when household income increase, the probability of mold being present decrease. Overcrowding was an important factor in the analysis. The definition of overcrowding in this study follows the England Shelter 2023 guidelines, with adjustments made to account for moisture contributions per person. There are some key findings on overcrowding and mold. In the 383 overcrowded homes, about 1 in 5 have residents with asthma or other respiratory conditions. 23% of residents reported mental health problems such as anxiety and depressions, and 54 households reported sleeping disturbance caused by the overworrying. Also, a correlation between overcrowding and mold was identified. Additional data such as the age of household members is needed to improve model accuracy. The study compared households with children and elderly individuals to assess the relationship between household structures, mold presence, and health outcomes. Families with children are more likely to have mold or dampness than families without children. Indeed, households with older people presented a lower risk of dampness and mold in households without children. In terms of health, families with children reported better overall health, both physical and mental, than families without children. This study demonstrates clear correlation between mold and various factors such as overcrowding, building conditions, socio-economic states, and health outcomes. The findings shows that the need for more detailed data in the future survey, particularly related to individual behaviors, such as window opening habits and age-specific moisture contributions. That's all. Thank you for listening.